Today we're going to talk about reverse shoulder replacement. So what is a reverse shoulder replacement? Well, first you have to understand standard shoulder replacement. Standard shoulder replacement's been around for decades and it's got a very successful result. It does, however, require that the patient have normal ligaments and normal rotator cuff tendons. This is an example of a standard shoulder replacement. There's a disc that cements into the shoulder blade and there's a part that goes into the arm bone and they mate together. But as you can see, it's very flexible and there's no constraint. The rotator cuff tendons and ligaments have to be present to hold this together. So for many years, this has worked great for patients who have normal anatomy. However, patients that don't have a rotator cuff can't let this work because what happens is without a rotator cuff, it slides up and then it starts to rock on the plastic and it becomes loose. The second thing is since it slides up, they can't raise their arm any better really than they could before they had surgery. So they get good pain relief, but they don't get good function. If you look at a reverse replacement, it looks like somebody put one of these in backwards. That's why it gets that name, because until you're used to seeing it, it looks kind of funny on an x-ray. The way a reverse replacement works is that instead of a plastic disc on the shoulder blade, there is a device called a glenoid base plate that screws into the bone. And then a hemisphere snaps onto that, and it's a press fit. Then on the shoulder side and the arm bone, we put a stem in that's press fit with variable sized plastic discs. And as you can see, that will stay together and not slide out of place without a rotator cuff. There's no tendons on a shoulder that comes in for this procedure. And the reason this works is it allows this to stay centered, which lets the patient have ability to raise their arm. And over 95% of patients that have this do great and are really glad they did it. Since this design has only been used for less than 15 years, and it's only been released for 10 years in this country, we don't know the actual true longevity of this prosthesis. So far, it's done very well, but I always caution my patients that heavy impact loading, such as using a chainsaw or a sledgehammer or an axe, is probably to be avoided. Also, very heavy lifting can actually make the prosthesis distract away from itself, and so I don't recommend lifting over 50 pounds on a regular basis to protect this prosthesis.